Welcome to KLEAN Radio, the show about addiction and how to overcome it, featuring celebrity and professional interviews with people in recovery and how successful treatment has brought remarkable changes in their lives. With your host, Andrew.
Yeah, it's amazing how pervasive, though, the issues of addiction and mental illness are in just daytime television. Obviously, it's a pretty major issue.
And Judah.
Well, it sounds profound if it doesn't make sense.
I guess so.
That's what I've learned about profoundness.
Break free of those habits that are controlling you. Life is waiting. Come and get it. KLEAN Radio starts now.
Welcome to KLEAN Radio. I'm your host, Andrew Spanswick, and I'm here with my co-host, Judah Friedman. You're listening to KLEAN Radio. We're a show about addiction and recovery. We're here on KFWB, News Talk 980, as well as News Talk 760 KFMB.
You're stealing my lines.
In San Diego. I am taking your lines, Judah.
It says there, read Judah.
You know, it's Judah, you can't have everything.
But who is Andrew Spanswick? A question I've been asking since I've known you.
Something to materialize over the course of the show.
Yes.
In the meantime, we'll stick with you.
No, but who are you? What is KLEAN Treatment Center?
Well, once again, KLEAN Treatment Center. Yes, we are a great treatment center.
Mm-hmm.
We specialize in addiction for drugs and alcohol, as well as dual diagnosis. We treat people with mental health issues. And we are in West Hollywood, California.
Second question that I've been hearing a lot about. What is a sober companion?
Sober companion is someone that
Sober coach.
Sober coach, sober companion. Generally someone that has at least a minimum sort of level of qualification to treat someone, and they actually follow that person around as often as 24 hours, 7 days a week, and make sure that they're engaging in a life of sobriety.
So do people get that before before they go to treatment, or do they get that after they go to treatment?
It depends on the type of trouble a person's having. Most often it's after treatment, and you have people that have gone through a 30 to 90-day program and then are trying to reintegrate into their regular life and are worried about whether or not they can stay sober on their own without somebody helping them as they face triggers and obstacles that might make them relapse or use again.
What do you say to people that, why do you need to go to rehab? Just go to the 12 steps. Get sober on your own.
I think, 12-step programs are great, and I think that for some people they're the right thing, but even everybody that goes to a 12-step program originally, when they're coming off of any substance, even if it's alcohol or a mixture of alcohol and pills or pills alone, they need to at least see a primary care physician as well first, because there's serious consequences to detox and detoxing, and one shouldn't just do that by themselves. We've seen recently in the news some famous people who have died just trying to detox themselves and coming off of alcohol alone. You can actually have a seizure, or you can faint and fall and hit your head. There's just simple things that can happen that you can die from.
Right.
So it's important to get medically cleared. A treatment center versus a 12-step program alone does that to another whole level where you have full evaluation from a doctor or a psychiatrist.
Hopefully.
Yeah, and then you engage in a series of groups and other types of interventions and events that let you learn how to be sober and how to live in a sober environment. And it introduces you to the recovery community, which long-term will give you the best chance of having a successful outcome.
And which is really what we would like to discuss on the show is life after you get sober.
Absolutely. I mean, it's important for us to say that, KLEAN Treatment Center is here, and we're here on the radio, and we're willing to take calls, and we want to take calls from people that are having problems with addiction during this holiday season. But certainly, we also want to talk about the successes of people who have gone through a problem with addiction and now have a really good life.
And have a radio show.
Yeah, so we like those calls too, So if you're out there and you're interested in calling in, you can call 888-539-2980. It's 888-539-2980. 888-539-2980.
I'm not sure you did that slow enough.
Yeah, well.
And you're taking all my stuff tonight. You're taking.
Okay, which would you like back? Take back what you want back.
Well, you're listening to KLEAN Radio Live, and we are on.
Start the show from the start again.
What's amazing is we're live now in San Diego.
I know. I'm excited. We have 2 stations now.
And you could also find us at KLEANradio.com. That's KLEAN with a K. And you can watch us live. We are starting something very interesting at KLEAN Radio. One of the people that works there, our CEO, Daryl Booth Olivier.
Director of Operations.
Yeah, Director of Operations, Daryl Olivier, came up with an amazing idea, and it's called my name, we came up with this, I came up with the name actually, it's called the 5,000 Likes of Christmas. So what we're trying to do is, at KLEAN, we'd like to donate, for everybody that likes us on KLEAN Radio, we're going to donate $1 to the Children's Hospital of Los Angeles between now and the end of and New Year's.
So it's facebook.com/KLEAN Radio.
Yes. So
KLEAN with a K.
Every like we get, we will be donating $1 from 1,194. So the goal is to get to 1,694. It's pretty good math. And we know a lot of people out there are driving home tonight. When did the holidays start so soon, by the way? It seems like every year they're getting soon. You know, it's December 5th. And
you're just getting older and time's going faster.
Is that what it is?
Yeah.
But, I mean, it's more depressing time. It's like it's like not even anymore like a week before Christmas I don't have money. Now it's like a month before I don't have money.
Well, certainly the recession is making the holidays more difficult. And it was funny, actually, as I was going around Thanksgiving parties this holiday, I actually had to go to 4 in one day, which is a little strange. But I noticed they were much more crowded at each house than normal. So definitely more people are pulling in and working as a community to try and get through hard times.
But, I mean, has it always been like this? I mean, I honest to God, I'm asking you this because growing up in a Jewish home, I remember Hanukkah, but I don't, and, you know, I don't remember the season starting so early.
Yeah, I don't think it's any earlier. I think
okay.
you're just noticing it.
I'm just noticing it.
Yeah, and you're around everything with the treatment center.
That's true, but it's also, I mean, I do think there's more. There are a lot of people out there that are struggling more this year, and I know there are people that are driving home right now that are, you know, after going, what am I going to do?
I think people are facing this different sort of position. I mean, we haven't had a real recession since '84, right? And, you know, things haven't been really this difficult, I would say, probably since the 70s.
Right.
So in a lot of people's lifetimes, this is the worst they've ever seen economically.
Right.
And it certainly has an impact on people's drinking and drug use. So it tends to be more people are trying to avoid problems personally, their feelings about them. And we see more abuse of drugs and alcohol.
So if you're going through any of this stuff and you want to give us a call at 888-539-2980. That's 888-539-2980. That's 888-539-2980. And if you don't feel comfortable in calling us on the air, you could also call us offline, and the number is?
Absolutely. If you have a problem and you'd like to talk to a treatment professional but don't want to call the studio, you can call our intake line. Where we have a treatment professional, and the number is 888-601-6040. That's 888-601-6040. So let's talk about our guest tonight.
Yeah, we have an amazing guest coming into the studio tonight. His name is Dr. Stuart Finkelstein. I hope I pronounced that correctly.
Good evening, Doctor.
Yes, thank you.
Welcome to the studio, Doc. My high school principal was Rabbi Finkelstein. I don't think you guys are related, but I should be able to say your name correctly. You never know.
How many Finkelsteins can there be?
A lot.
Really?
I just want to say, Andrew, it was very nice to visit the KLEAN campus today before I came to the show. It's a beautiful center.
Oh, well, thank you. I appreciate that. Yeah, it was good to have you take a quick tour. We always encourage people to come tour.
Yeah.
And even families and people with problems, if they want to just come by and take a look, it's great to come by and take a look and see what actually happens there. Take some of the mystery out of it. I think a lot of people are afraid of treatment centers. They see them as this big sort of institutional type of setting, and KLEAN certainly isn't that. We're much more residential and comfortable, and yet we still have great clinical, both medical and therapeutic services.
It was a very beautiful, comfortable campus. I enjoyed visiting it, and I'd like to say that I really believe in treatment centers' help. I'm a very firm supporter of the 12-step system, but the residential treatment centers seem to help jumpstart recovery. I find a lot of patients will hide out at the coffee pot when they originally get into a 12-step program, but by going through a program such as KLEAN, they're introduced into recovery and get some of the concepts of sobriety at a much faster rate.
I think you're right. And one of the things we specialize at with KLEAN is dual diagnosis clients. So people that have a primary or secondary mental illness as well as a substance abuse problem. So, you know, I think that is very undertreated or recognized within just the 12-step community. So I think it's important that people actually get that kind of medical screening.
Well, one of the reasons I asked you that question, and I know you obviously heard us talking about it outside, is because that's one of the things family members often say, is when you want to get sober, and they're like, well, just go there. Why do I have to pay for treatment?
Right.
And that's one of the biggest things I've heard parents often say, or family members often say, is why do I want to make this investment? And it's very funny because if you have heart surgery, nobody ever says, oh, why do I have to pay so much?
Well, Dr. Finkelstein, I mean, you've been doing this for a long time, right? You've been in addiction medicine, you were talking earlier, for over how many years?
30 years.
30 years. So you've seen a lot of patterns sort of come and go in terms of just social models like 12-step programs, the medical models, and now all those sorts of psychopharmacology that we're seeing as new ways to treat addiction. What's your take on sort of where addiction medicine's going and what we should look for now and in the future?
I think that the future is going to hold medical assisted recovery. I think that there's some new medications that are great tools for physicians to use in helping a person get recovery, get the concept of sobriety. We've seen suboxone, buprenorphine come on board now. Just recently, naltrexone or Vivitrol was released for the treatment of opiate addiction. These are wonderful tools to aid the recovery process with the psychosocial model.
So if your average listener out there is hearing this and saying, oh, here's another doctor that just wants to give one medication to treat another medication, or a problem with another medication, what's different about these new medications that are not just sort of adding on another medication?
Like methadone.
Yeah. Like methadone hasn't always been the best thing for people.
Well, methadone is a pure opiate, and people who are placed on opiates, on a pure opiate, get more addicted. Their brain becomes more dependent upon it. I find buprenorphine a much safer drug since it has a ceiling effect, and taking above a certain amount, 24 milligrams, doesn't seem to produce any more effect, and that people request coming off of it.
Oh, so there is an exit strategy with it.
There is an exit strategy of it. I think that people don't realize that there is a withdrawal,
Right.
So it's not a free lunch.
Right.
A lot of people think that there's no withdrawal for suboxone, but there is. I think
That's not a bad thing.
No, it's much gentler than coming off of a pure opiate, and it stabilizes a person while they engage in treatment and get some tools of recovery. I think naltrexone's a fabulous drug. There's no high associated in it. It protects a person from becoming physiologically re-addicted again, and I think it actually gets rid of the committee meeting. I had one patient tell me that you can take opiates out of the body, but you can't take them out of the brain, and I think that naltrexone actually does remove that little voice on your shoulder.
The craving.
The cravings.
Right.
I think one of the cool things, and Andrew and I have discussed this a lot, and one of the things I love about what both of you guys do is that you're I think for a long time there was a fight in the treatment world on both ends because people in the 12-step community felt like the people that were giving drugs were basically saying, well, this you don't need to go to you don't need the 12 steps if you're taking this, and vice versa. But you're basically saying they could coincide together.
Well, there's been two central camps that have been fighting for a while.
Right.
You have the public health model camp that believe that replacement therapy is a medication, and then the mitigation of secondary externalities. And for your average listener, that means problems that happen secondarily to drug abuse. So if somebody's, say, shooting up heroin, and you can give them a medication that blocks the use of them needing to use heroin, then they're not going to be stealing things from other people. So it blocks that secondary problem. It actually replaces the heroin so they can actually function and not steal. There's been that debate whether or not we should have a public health model that deals with addiction, uses replacement drugs, also protects people from secondary illnesses like AIDS and HIV and Hep C from shooting up, and all the other illnesses that people can get from using IV needles. So you've had that one camp, and then you've had the camp that's purely based in a spiritual modality of cure, really, or not cure, but at least progressive engagement. And we've seen that with this 12-step community where Would you agree with that, Doctor?
Yes, I do, and I think that there's also the camp that's just medication orientated
Right.
and does not include psychosocial treatment. And all the studies show that when we combine the therapies, we get much better results.
And it's one of the things that actually really drives me crazy, because anybody that's really involved in the 12 steps and reads the Big Book of Alcoholics Anonymous, which was an amazing article this week, or an amazing video that's been going around, which is Newt Gingrich talking about how the Big Book of Alcoholics Anonymous saved his life. He's not an alcoholic, but he had a friend that
He's
gave
still
it
a
to him.
politician, though.
He's still a politician, yeah. But the
Didn't
friend
save him from that.
but the friend gave it to him because his life was spiraling out of control, probably with other addictions, and
Well, he had all those affairs.
with
right?
all the affairs and stuff, and it's he talked about how it saved his life. But one of my favorite things in the Big Book of Alcoholics Anonymous is that it actually says this might not be enough for you. We encourage you to get outside help.
The central office has a pamphlet that says that if a medication is taken as directed by a physician, that it's okay. Now, sometimes a member of Alcoholics Anonymous might not realize that and try to guilt someone in 12-step therapy, but the actual central office is okay with medically assisted therapy as long as it's taken as prescribed.
You're listening live to KLEAN Radio. You're on KFWB and 760 AM San Diego KFMB. Give us a call at 888-539-2980. That's 888-539-2980, 888-539-2980. We're in the studio tonight with Dr. Stuart Finkelstein. And welcome again. And sorry for the brief interruption.
I like how Judah's doing his re-intro. You got it, the whole intro that time, though.
Yeah, I did. I messed it up. It was circled, and I got a little distracted. I'm not perfect, Andrew.
Well,
I know you expect me to be.
I do. I have high expectations.
So what do you recommend to people that come into you and say, I have a problem? Because when most addicts or alcoholics are getting sober, they're not exactly the most honest people. So how long before they get into therapy? Should they start therapy right away? What's the suggestion?
Well, initially, I think they need to be detoxed safely. As Andrew pointed out, sometimes if you abruptly stop a medication such as alcohol or tranquilizers, you can have a seizure. And maybe coming off of opiates such as heroin, methadone, Vicodin, OxyContin may not be life-threatening. People sure feel like they're going to die coming off of those medications. So the initial process is to stabilize them by detoxing them and then introducing them into the rehabilitation community.
I don't think people realize how dangerous it is detoxing off benzodiazepines like Xanax and Valium. Seizures is the number one problem. I think it's probably one of the most dangerous detoxes.
I do too. I would rather detox off of heroin than Xanax. It looks so uncomfortable. They have so much anxiety. And it's not just seizures. They can actually become psychotic.
Interesting.
I don't think a lot of people realize a lot of things. I was at somebody's house the other night, and I'm not going to say who, but obviously because I'm going to share a story about them. But they were sharing a story about how they had cocaine in their house for a year and a half. And they didn't use it. They were bragging about that part of it. But they were also, like, it was nothing that the person was talking about binging on it.
Well, what happened in a year and 7 months?
That was fun. But yeah, I know, right? Yeah, that's actually funny. I didn't think about asking that.
Should have.
Was there a shelf life on the coke? And did it expire at that point? But they didn't. We've spoken about this. The dangers of using cocaine just recreationally, the scar tissue it creates on your heart, and all the other.
Yeah, I don't think people, we've always talked about drug use, drug abuse, and drug addiction, and how, traditionally people didn't get treatment until they were fully addicted. We're starting to see now people come into treatment who are just using and abusing drugs. But I think there has been a minimalization in the general public about the general use of these substances. I mean, they're unregulated. We don't really know what's in them. There was that weird fungus that's been going around in cocaine that we read about a few months ago. Yeah. There's some skin-rotting fungus they found in like 70% of the samples of cocaine they were testing. What's your take on this, Doctor, of just general drug use?
You also mentioned the scar tissue of the heart, but there's also scar tissue going on in the brain, too, and changes that are occurring in the brain also.
Right. And if you're snorting, it's affecting your lungs.
And you can also get hep C from straws, sharing straws.
Interesting.
Really?
Yes.
Huh.
It's not just sharing needles, but
It's
sharing
the last time I
straws.
share a straw with you, Andrew.
I'm not going to McDonald's with you anymore.
Yeah. Really, but that's actually a very interesting thing that you're saying, because I don't think people. It's
I
like,
didn't know that. I had no idea you could get Hep C from a straw.
From a straw.
Wow.
Make sure you bring your own straw to the next party.
Yeah, right.
Or your own dollar bill. But what about ecstasy?
How many $100 bills have cocaine in them?
Well, they did a study and
lot.
they sampled them randomly out of ATMs, and they all tested positive for cocaine at a very low level, but.
Yeah, not enough to
Yeah.
get you high. You need like a lot of hundreds. But what about ecstasy?
Boy, ecstasy is a very interesting drug to me. Do you know that it was developed by Merck Pharmaceutical Company in 1912?
MDMA was?
Yes.
Really? I didn't know.
And that in the 60s it was called empathy.
Huh.
And it was used for marriage counseling. And then
Right.
they released it in the community in Austin, and it outsold the beer in the first weekend.
Wow.
And actually, they're doing some interesting testing now for post-traumatic stress disorder with some of the veterans returning from Afghanistan and from Iraq.
Yeah, I know there's a lot of psychologists that are pushing for the reintegration of it to be able to be used as a medication. I've always thought it was kind of cheap, though. I mean, in a way, you put a couple together that's having problems, you give them ecstasy, and all of a sudden they like each other again. Well, duh.
Right.
You know what I mean? Like, I don't know if that's really genuine, is it? I mean,
But
Well, I mean, that's actually one of the because I used to drive me crazy. I was in rehab years ago, and one time I was talking to one of the therapist, and I said to him, he's like, no, but it was different in the 60s smoking pot. And I'm like, why? Because you thought it was different? In the 60s somehow it became spiritual.
well, it wasn't nearly as strong.
It was much less potent. It was 2 to 5% THC,
Wow.
and now with the strains they have now, it goes up to 29%
Right.
with these, funny names.
Yeah. Kush, snow cap.
Right.
Purple Kush.
But the amazing thing is people that are 15 and 16 years old, and I don't know much about the brain growing, but they say when the brain grows from 15 to 23, what is it?
Later. Yeah.
And you're
Well, I think now we found it doesn't really stop growing, right? It repairs itself. It changes.
Correct, but
Neural pathways are changing constantly.
But I think we stun our psychological growth when we start doing drugs.
Right.
And I think that's a very important concept to realize, that when we start doing it recreationally, and then we start doing it to modify feelings, and we do not grow emotionally.
You're listening to KLEAN Radio Live. We're in the studio tonight with Dr. Stuart Finkelstein. Give us a call, 888-539-2980. That's 888-539-2980. We're talking about a lot of different topics tonight, but I think there's a very serious topic, because you constantly hear people that just joke about drugs that they're doing. That like it's nothing. Oh, I went to a rave. I did some ecstasy. That one time you're doing ecstasy could have a really lasting effect. First of all, you don't even know what you're putting in your body.
Well, I think the psychosis point, right? Everybody has a threshold at some level that they could become psychotic, right?
Correct, and then sometimes that's not reversible. Also, there's something really interesting about ecstasy, is that you lose your ability to thermoregulate. If you're in a cold environment, you can get much colder. If you were in a hot environment, you can get much hotter. I remember one time at a rave, someone turned off the water so that he could sell more water bottles, and patients took ecstasy and they overheated and had seizures.
Wow.
And also, we used to have something that we called the Terrible Tuesdays.
Mm-hmm.
You took E on you rolling balls on Friday and Saturday, and you stopped on Sunday, and you're in school on Tuesday, and you hit a depression that you think you're never going to get out of.
I've never heard that term, rolling balls. and no, but yeah, I mean, it's the coming down from ecstasy is
a terrible depression.
It's horrible.
Right. And that's just because you've blown out your neurotransmitters, right? I mean, you've just saturated the neural gap with serotonin and dopamine, yeah?
You got it exactly right.
And so it has to recover and then re-regulate.
You've depleted the neurotransmitters on, I don't want to use scientific terms, but the presynaptic cell. And our body likes to stay even. Yeah. And when we're in the snow, our temperature's 98.2. When we're in the desert, it's the same. If you put a drug in your system, the body wants to get even. It does that by depleting the neurotransmitters, or on the postsynaptic cell, it downrates the receptors. So there's less receptors to keep the cell from firing.
And that's why people talk about having to do drugs or drink just to feel normal. Right? They're just trying to elevate.
Brain plus drugs equal normal. Brain minus drugs equal an abnormal state. And that's when you need treatment.
And I notice a lot of these people, and this is a Judaism, I'm totally generalizing, but if you do ecstasy on Monday and think because you went to Whole Foods and got a healthy meal, you're healthy, it's not, to all you Whole Foods people out there, all you think you're cool because you go to Whole Foods and you spend more money on fish and meat.
Marijuana's fine because it's natural.
Because it's natural, and you're taking ecstasy one day a week. It affects you.
What about exercise too?
Those are the same people. Yeah. It's because I went to the gym 6 times this week, but I did ecstasy 3 times. It doesn't
offset.
At
the gym,
right? Just be like Andrew and I. Be honest. Like, we don't go to the gym. We eat. We're unhealthy, but we don't do drugs anymore.
Something.
Yeah. But how many people are doing that? I mean, there's a lot of drug abuse and.
You're trying to make a distinction between abuse and dependence.
Yes.
I think that I believe that there's 5 areas of life: medical, legal, financial, relationship, and work.
Right.
And if you're using and affecting any one of those areas in a negative way, you have a problem.
Yeah. Which goes to like somebody like Bill Clinton, which was often talk about sex addiction. Even Newt Gingrich, for that matter. I don't know if he's a sex addict, but it definitely has affected his career.
Or listening to Klean Radio, you can give us a call at 888-539-2980. It's 888-539-2980. We'll be back in about 90 seconds after this break.
Do you suspect a loved one is abusing drugs? Call Klean Treatment Center at 888-601-6040 for a free drug test and consultation. A treatment advisor is available to help you administer the test and answer any questions you may have regarding treatment and more. We are here to help. Call us today at 888-601-6040 or find us online at cleantreatmentcenter.com for your free drug test and the start of a promising future.
Welcome back to KLEAN Radio. If you would like to join in on the discussion or are in need of immediate addiction assistance, call 800-539-2980. That's 800-539-2980. Or go to KLEANradio.com. That's clean with a K. Now, back to Andrew and Judah.
Welcome back to KLEAN Radio.
Here we are.
Yeah, here we are. You're listening to us live on 980 KFWB or 760 KFMB, or you might be watching us or listening to us live on KLEANradio.com. That's clean with a K. We have a few callers, but before we get back to them, I'd like to remind everybody out there listening, we have a new program at KLEAN. We're calling it the 5,000 Likes of Christmas, and that's for every like that somebody likes us on Facebook at KLEAN Radio, Facebook/KLEAN Radio. We'll be donating $1 for every like from now till New Year's. To the Children's Hospital of LA. We'll be matching, hopefully. I want Andrew to have to spend $20,000, so I would love for 20,000 likes. And welcome back. We're in the studio tonight with Dr. Stuart Finkelstein, and we
have a lot of calls lining up already, so why don't we just get right into them? We got TONYA from Lake Balboa. TONYA on KLEAN Radio. How are you tonight?
Hi, guys.
Hey, TONYA.
Hello. I love this subject you guys are talking about. I love it. Basically, I'm calling because my mom is a recovered for 27 years. She used to do coke. It was bad because she even had a hole, gotten to the point where she got a hole in her nose. Mm-hmm. And I just wanted to touch upon how much it's affecting her now, because people young are doing doing coke and stuff out. And they don't realize that later on in the years, it's just going to affect them so much. The nervous system, we were talking about with the heart and everything. It was just, she's very healthy because I'm in the health industry and I've kept her really healthy. But her nervous system, it's still to the point where, she doesn't have a lot of tolerance and it's hard for her.
TONYA, how old is your mother now?
She is now 61.
This is the second call we've had in a week from someone who's over 60 that's, dealing with the effects or has been involved with a substance abuse problem. And this is something that we're seeing more and more in our society as people are living longer. Dr. Finkelstein, you're an expert actually in geriatric
Well, her mother's
addiction,
sober
right?
also,
Her
27
mother's
years.
sober, but I think it's going to be worse now because she mentioned her mother's nose, so that means she was snorting the coke.
Right.
Now they smoke the coke, and it's
And
at least
shoot it.
shoot it and smoke it, and it's 200 times more powerful and causing a lot more damage. Coke is a vasoconstrictor, and the small blood vessels in the brain you mentioned in the heart get closed off. I just had a patient in the hospital go into heart failure because they were shooting coke, and the vessels closed, and the patient had what's called ischemic heart disease and was short of breath.
And how old was that client, that patient?
That client was 37 years old. He
Wow.
was short of breath going to the bathroom. Of course, as soon as we gave him some Lasix and took some of the water off of him, he felt better and signed out of the hospital AMA. Came back, 8 hours later, but
Right.
the urge was so much to go get the coke, even though his heart was damaged.
Tonya, what kind of healthcare professional are you?
I'm actually studying traditional Chinese medicine, and right now, like in Chinese medicine, it's with her, it's the shen, it's the heart, because it's basically disturbance of the mind. So it's really hard for her to find herself to calm down. She doesn't I have to teach her and kind of train her, and it's really, she always goes towards the negative, and I have to kind of implement slowly ways for her herself to calm down. She's very religious, so that's her way. But I know that there's other modalities, like Tai Chi and yoga and things like that she has delved into slightly, but she doesn't routinely do it. And I notice the difference when she does routinely do it. It does calm her down. When she doesn't, when she stops, then it just gets to the negative. But she goes to the dark side, basically.
Right.
Well, I think she's mentioning the severe
But I
depression.
wanted to mention also, I have another friend who had spine problems, and he got put on Oxycontin, and then he got addicted to Oxycontin, and then he had to get off the Oxycontin because he was so addicted to it, and then of course that was affecting his liver, because any medication you take in Chinese medicine, it's going to go into your system, it's going to affect the liver, and the liver is for the emotions. So once the liver is taxed, then your emotions, you have higher irritability and anxiety. And so, but with him, I felt bad because he's got neck problems, and now he's addicted to the medication.
Okay, Tonya, thank you for your call, Tonya. So, Doc, one thing that was mentioned was AMA. For those people out there that don't know what that means, it's against medical advice. So a lot of
It's
people
not the American Medical
right,
Association.
it's not the American Medical Association. So a lot of people that come into treatment and into the hospital, they have to still voluntarily want help.
Correct.
And then if they don't, they can just sign themselves out.
Correct. I like that call because it mentioned something about the depression that people get coming off of coke, and that it can be lifelong. I remember when I was in medical school in '76, the textbook told me that cocaine was non-addicting.
Right.
Non-addicting. Then the next page talked about extinguished responses with rats pressing a lever. And a rat will press a lever 500 times for a hit of heroin, but will press a lever 5,000 times for a hit of cocaine.
Right.
So again, coke at a young age has led to an intractable depression at an older age.
Intellectually just speaking, right? Just to the people listening out there, just intellectually, nothing can make you feel so good that's unnatural that can't have some bad result later on. As far as using coke, marijuana, ecstasy, it just stands to reason if you're doing something, with your brain.
The way I explain it to my patients, there was an interesting study looking at dopamine in the pleasure center. It goes up about 50 points in response to food. The best thing in life other than food is
Sex.
Goes up about 150 points.
Julie didn't know that, by the way. I had to point that out to him. He's
I'm
still
like
a little
happy
young.
now.
It goes
Build up.
Then it goes up to about 300 points for cocaine and 1,000 points for methamphetamine.
Right.
And most people use methamphetamine. It's methamphetamine and sex, so you're in the stratosphere. And I always talk, if Neil Armstrong, who walked on the moon, came down here and walked around the park, would he register that as a pleasurable experience? So once you've taken your brain to such a high level of pleasure, how can you achieve pleasure from normal
so
life?
where's the hope? I mean, because there's a lot of people out there that have been using drugs, and we know that a lot of people in college will use drugs, or in high school will use drugs recreationally and then stop or moderate their usage. Where's the hope for people that have been addicted? How do you get them to the point where they don't suffer from long-term depression and they can live a happy and productive life going forward?
I think you need to have a spiritual change.
And
the
that
answer is
means
spirituality.
And what does that mean?
A connection with other people, a connection with reality, with everybody around you. There's a chemical called oxytocin that's released for when a baby cries, the mother causes milk letdown. Well, we find out when we see somebody that we like, we get that same release. And I think it's the connection with other people that allow us to overcome it.
Do you think our society with the internet and us sort of becoming more and more isolated is leading to more and more drug abuse?
I know it's leading to more and more difficulty in treating drug addicts because when they come into my office, they know so much off the internet when they walk in, and I have to sit there and talk about all the receptors and, mu, kappa, lambda receptors, and I haven't treated a heroin addict with suboxone, a young heroin addict with suboxone who hasn't tried it on the street first.
Huh. Interesting.
You're listening to KLEAN Radio. The number here is 888-539-2980, 888-539-2980. One more time, that's 888-539-2980. We're in the studio tonight with Dr. Stuart Finkelstein, addiction specialist.
And one of my favorite sayings about people that look up medical stuff on the internet is, if you look long enough, you end up with brain cancer, no matter what your symptoms are.
Right, and everything masks each other, it seems, these days. It's
well, also the idea that somehow WebMD and the internet and a person searching can qualify as someone who's had 30 years of both clinical and educational experience in medicine. I mean, it's just ridiculous. I mean, there's so much value out there medically from our treatment professionals that is undervalued, I think, because of the internet.
And I think it's also very important. We're talking about we always talk about risk and reward, and the reward from doing something like cocaine, from doing drugs recreationally, compared to the risk, it's fairly fascinating what people are willing to do. And I mean, we're saying recreational, not even addicts, that you're willing to die for a high and that rhymed, is very, I mean, that's...
I think most people are in denial.
Yeah.
I think most people don't really, or they're suicidal and sort of don't recognize that they're depressed, suicidal, and they don't care.
Well, I don't think anybody ever starts out wanting to cross the line.
Right.
But you don't know where the line is until you've crossed it.
Right.
Hey, we got a great call. We got a call from Irvine. It's Delia. Are you there, Delia?
Hi, guys. How are you?
Good. How are you?
Thanks. I'm really enjoying the show quite a lot.
Oh, great.
I'm 6 years clean and sober.
Congratulations.
And thank you. And I've been through my share of fun. And, the one thing that I cannot kick is the eating disorder. I've gotten past the depths of my demons as far as alcohol and drugs are considered, one day at a time.
Right.
But I have dual diagnosis with bipolar and eating disorder. And
was the eating disorder there prior to the drug abuse?
Yes, not quite as bad, but yes.
And what type of eating disorder have you been suffering from?
Anorexia bulimia.
Right. So that's fairly common, actually. We see that quite a bit at our treatment center. Dr. Finkelstein, you have any comment?
I also wonder if there was any childhood abuse issues, because eating disorders are often another way of control.
Yes, absolutely.
Yeah. I mean, we do see that. We see where the child often, the one thing they can control is what they eat.
Which is isn't that would be obsessive compulsive disorder?
Well, no, that's something completely different. But thank you for having us there to clarify that you're wrong.
Yeah, thank you. Thank you,
that's
kind
Judah's
soul.
role.
Thank you, kind soul.
But in all seriousness, people often, women especially, but even now we're seeing it more in men who have been sexually abused, the one thing they control is what they eat. And so that retaking of control over the aggression of someone who's abused them is often manifested pathologically in an eating disorder.
I find eating disorders very difficult to treat, but I find the most effective therapy is group therapy and people that have walked in your shoes.
Yeah.
Well,
And if
I've been in Overeaters Anonymous now for a little bit of a time, And I've just, I guess it's because it's such a thinking. It's not black or white like alcoholism, but I've really struggled with that. And being on my bipolar medicines up and down with the different trials of that, I've got that, seemingly stable these days with no episodes, but the eating disorder is how I'm playing it all out still. It's where my chaos and my drama is, and I'm not having a life because of it still. I just feel like this is the last monkey on my back, and bless my heart, I am trying too hard to do something that is just not getting any better.
Hi, this is Jude. I just want you to know you're not alone. I'm sober a little over 13 years, and I want you to know that you're not the only one that struggles in, the 12-step world with, what do you call it, Andrew? The other addictions?
Dual diagnosis.
Dual diagnosis plus sub-addictions and all that
Secondary
stuff.
addictions.
Secondary addictions. A lot of us have gone through this stuff, whether it's food, gambling, sex, and we do make it out the other side.
Yeah, I understand that.
Andrew,
Yeah.
sometimes she mentioned.
Can you speak?
I'm sorry, Delia. You need to speak into the phone.
I'm sorry. It's just so frustrating because to the best of my ability, I do not pick up the bottle and I do not pick up the drugs, but I do pick up that fork.
Right.
And unfortunately, it is legal. So.
Well, you can't not eat. And, this is where being in a supportive group where your sense of reality testing, I don't want to overgeneralize, but people that have eating disorders and other secondary problems related to substance abuse and body image issues, body dysmorphic disorders, they don't have a real sense of what they look like or what their weight really is or whether that's healthy. And they normally, that their sense of self is often very, very distorted, primarily from that early trauma. So it's important to be around a supportive therapist. I think.
Do you see a therapist?
I do. Yeah, I have a counselor. I attend a group through my HMO, which is horrible, but I go.
What about a
And then
psychiatrist?
I have a psychiatrist who I see a couple times a year. Yes, absolutely. Not as much as I'd like.
There's some great work in dialectical behavioral therapy for body dysmorphic disorder that also comes along with eating disorders. I'd recommend you looking at that. Doctor, you have a point?
I have a question because when you mentioned bipolar disorder, there's a couple drugs, Depakote, Zyprexa, Seroquel, that are used to treat bipolar disorder, and one of their side effects is excessive eating and weight gain.
Right.
So I don't want.
Definitely not. It's definitely not been a side effect that I've noticed. Actually, I have a severely suppressed appetite, and I've been on all of those drugs, and really the only side effects that I've ever felt from those were grogginess or zombiness.
Right.
And that's nice because at least I'm not in episodes, but I can't tie my shoes. So.
Well, Delia, I just encourage you to stick with treatment and also realize that over time your body and your body chemistry is changing. So you're going to see changes, and you need to constantly be under a physician's care. And I encourage, I'm very encouraged by the amount of courage that you show in facing these multiple issues and sharing them with us tonight. So keep listening, and hopefully we'll have some more advice for you as we go on tonight.
I think that's extremely important what she's talking about, because it's something I've learned in the 12 steps in a lot of years is that, they always say the newcomer is the most important person in the room, but people with time go through struggles too. And I think sometimes one of the biggest fear of people with time is to be honest about the struggles they're going through, because they don't want to look to they don't want the newcomer to go, well, where's the hope? And they don't want to be embarrassed by it.
I also worry about, sometimes in meetings they say, we ask the newcomer to stand up if you have less than 30 days. And someone who's been going to a meeting for 8 years, we say this not to embarrass you, but to better get to know you. I've sat in that seat for 8 years. If you don't know me by now, you're not going to know me. And if you don't think me standing up embarrasses me, you're wrong.
Yeah.
Right.
It's and with the courage it took for Delia to call us tonight, it is absolutely amazing, and that's the help. That's how she's going to get the help I heard early on in my sobriety, you can't save your ass and your face at the same time.
I
hope I could say that.
We're gonna jump into another call here in just 1 second, but I just want to say, if you are out there and you do have a problem and you're not willing to call on the air live, you can call one of our private treatment counselors, and they can give you help or get you help, whether you have resources or not. The number is 888-601-6040, 888-601-6040. Let's go to our next call. We have Liz in Venice Beach. Liz, you're on KLEAN Radio.
Hi there. Yeah, I was wondering what you guys thought about sober living homes that don't allow people to be on suboxone or that do, and what your thoughts are on that.
Great question. And Andrew and I were discussing sober livings this past week.
Yeah, Liz, have you had experience with this?
I actually have a sober living in Santa Monica. We've been around for about 7 years, and for a while I didn't allow anyone in, and I've recently, actually in the last couple of years, I've kind of been, case by case, and I feel like I don't know, I think things are changing, and, a lot of times I'll talk to the client's doctor and see, and base it on that and see, does this person have to be on it, or can they live without it? And there's just so many young people dying.
I'm really encouraged to hear someone that owns a sober living sort of standing up for that position. The 12-step community in some ways has so much bullied treatment providers into making people only get extended care by being fully sober. And I think the research actually doesn't support that that's the best way to go. Doctor, your studies with suboxone and titrating off, and
the research doesn't support that. I think that you have the right answer, case by case.
Right.
I think every case needs to be looked at individually. I don't want a young person on suboxone for a long period of time because I think that there is a withdrawal off of suboxone. But someone who's been using opiates for 30 years and has a chronic pain syndrome, I think that's someone that I want to maintain on suboxone.
So generally, the younger and less exposure they have, the shorter they should be on suboxone.
Correct.
And then the more they've become sort of accustomed and their brain chemistry has changed from long-term opiate abuse, probably the longer they should either be on it or maintained on it permanently.
Correct. Also, is there any other comorbidity such as a herniated disc?
Right.
Or chronic pain
issues that might cause them to trigger and relapse if they were completely sober.
Yeah. The drug in suboxone is called buprenorphine. It was invented in '78 for the treatment of pain. It wasn't invented for the treatment of addiction.
Right.
And it's a very potent anti-pain medication.
So it's an opiate antagonist, though, correct?
It's a partial agonist.
Right.
Which means if you look at an opiate opening, if you have a model of a room and a door in a room, a drug is like a key that fits on a keyhole and opens up the door. All the way would be a drug like methadone. Half the way would be a drug like buprenorphine. And then a drug like naltrexone fits in the keyhole but doesn't open up the door at all. And now the drug can't bind.
So it's a blocker.
It's a blocker.
Right.
And to me, the question always is do I put it on the pure all the way door open or the door half open, or do I put the blocker in there? And that's the challenge of addiction medicine now, is which patient belongs in which spot.
I think as we talked tonight about how addiction and the treatment addiction has become more and more sophisticated, even within the last 5 years, I've seen an incredible change from no medication to, these things actually play an important role in the treatment of addiction. We're seeing that now throughout the different levels of care. And Liz is a great example of where sober livings, traditionally, everybody had to be completely sober to go to a sober living. And now we're recognizing that there are actually medical conditions within this broad definition of addiction that do deserve medication.
I really liked her response when she said that she was evaluating it case by case.
Was that helpful, Liz?
Yes, absolutely.
What's the name of your sober living?
Victoria's house.
Victoria's house. Very great. Yeah, we like Victoria's house. It's a wonderful place.
And how do people get in touch with you at Victoria's house? I don't know Liz, but I don't know Liz, I'm saying, but how do people get in touch with you?
Well, they can go online, victorias-house.com, or they can call our number, 310-581-5746. And but we do have a contact through the website. They can send us an email.
Yeah, actually, if you go to cleancenter.com, under our community partners, Victoria House is sober living that we've actually done some work with. And I didn't recognize you, Liz, but thank you for coming on.
Thanks a lot.
Thank you, Liz.
Have a good night.
I think it's extremely important what we're talking, what Liz just called, because there has been a fear, and I'm a big 12-step person. I'll say that, and Andrew knows that. But I think there has been a fear for a long time of, medical, like we've been talking about, the medical community being ostracized. I mean, it's often you don't hear, when you get up there and you don't hear a speaker sharing about being on Lexapro, about the need that person needed to be on drugs to get.
I had a patient on it that had seizures that was on an anticonvulsant and went to a 12-step meeting, and they told her that they couldn't take that medication.
Right.
She stopped it and seized.
Right.
It's terrible.
And thank you so much. We're in the studio tonight with Dr. Stuart Finkelstein. And one of the things, Dr. Stuart, you're going to be doing this week is there's a convention in town called the Evolution of Addiction Treatment. It's
created by one of our good friends, actually.
Alan Berger.
Yeah, who's been on our show.
Who's been on our show.
I forget which episode number. It was the first season.
It was like episode 3. And he came in with Brian Scannell.
Right, so you can go to cleanradio.com and actually see Alan.
Yeah, and he was written a few books, the 12
stupid things that mess up recovery, and 12 things to do when the booze and drugs are gone.
And this will be from December 8th to December 11th, 2011. It's the Evolution of Addiction Treatment in what goes on there.
Every major speaker that I know of that's made a video or that I enjoy listening to will be speaking at this conference.
That's great. And it's open to the public, correct?
It's open to the public. It's $150 for 4 days worth of talks. It's $450 for continuing education.
And then there's a free thing for Betty Ford tribute, I believe.
We're honoring Betty Ford on Thursday. Joe Persh is going to be honoring Betty Ford, and that's free to the public. There's going to be a dance, a sober dance on Saturday. I'm really excited about this program. I've never seen such a list of speakers put together speaking on addiction before. This is very exciting for me.
And where is it?
It's at the West. It's at the Westin.
On the front.
I'm looking. It's at the Westin.
By LAX.
It's at the Westin by LAX, and there's a sober dance on Saturday?
Correct.
And how much is that?
If you're a member of the conference, it's free. Otherwise, that's $25.
And that's going to be just a lot of sober people with clinicians having a gay old time. And it just sounds like fun.
There is fun in sobriety.
Yeah, there is fun. And
it's like I say, the loudest table in the restaurant is the sober table.
We were talking about that the other night. We actually, Andrew and I had an amazing time the other night. We were at the Mighty Ducks game, or the Ducks of Anaheim hockey game. We actually got to walk on the ice before the game and watch the shootout. And we were really loud. We were like, they were like basically inviting us back anytime we wanted, because they were so shocked that we were sober having fun.
And you remembered it.
Yeah, and we remembered it. We got 3 pucks.
We got 3 pucks.
My girlfriend actually got all 3 pucks.
She got them. She was winking at the hockey players, and they were handing them over the ice.
And so are you?
We're shameless.
We are shameless. And are you speaking at this event?
I'll be speaking on Saturday. I'm going to be talking about addiction as a brain disease and medically assisted therapy, and I'm also going to be talking about where I think where treatment's going. Some exciting new research on pharmacogenetics, functional MRIs, reference EEG, so that we might know who's going to respond to what medication without so much guesswork.
Great. That's the Evolution of Addiction Treatment. It's going to be in the Westin from December 8th to December 11th. It's $450 for the whole weekend.
That's if someone needs continuing education, but it's to the general public. It's $150 for the whole weekend.
It's definitely worth it if it's a topic you're interested in. We're ending our show pretty soon here. I'd just like to mention once again that you can go to cleanradio.com, check out more about us, check out all our former shows. We also have a free drug test kit that's available that parents can use, and you can talk to one of our counselors and talk about how that might be useful if you think there's a problem with drugs within your home.
Andrew gives it to me all the time, and
just to make sure.
We just take it everywhere we go. And we also would like to just talk about quickly the new program, and you just like us on Facebook on KLEAN Radio.
Right, facebook.com/KLEAN Radio.
And we will be donating $1 for every like from now till the end of New Year's to the Children's Hospital of Los Angeles. And, write down when you like us if you'd like, what you're grateful for this season. Dr. Stuart Finkelstein, thank you so much for coming in.
Thank you for inviting me.
It was a great show, and we'll be back next week on KLEAN. You've been listening to KLEAN Radio.
That's KLEAN with a K.
Do you suspect a loved one is abusing drugs? Call KLEAN Treatment Center at 888-601-6040 for a free drug test and consultation. A treatment advisor is available to help you administer the test and answer any questions you may have regarding treatment and more. We are here to help. Call us today at 888-601-6040 or find us online at cleantreatmentcenter.com for your free drug test and the start of a promising future.